Next question is, how might these issues present themselves to therapists who mainly work with individuals or couples? So these issues meaning the issues of families, the issues of interactional patterns, the issues of trauma. How do you see that these issues present themselves to therapists who mainly do individual work or couple work?
But one of the techniques in this model, which is called the family systems trauma model, is a technique right out of the gate for diagnostic and assessment is the stress chart.
Mhm.
And it's a simple visual thing that you put on a dry eraser board or a PowerPoint slide, which gets at to the family immediately or individual or couple. How stressed out are you on a bad week?
Mhm.
0% you're not at all, 100% you're through the roof. And so people start to see their stress, and then you say, in relationship to whatever percentage you gave, let's say it's 100%, what are your top three stressors? And then you do what's called a circular question. You said, I know that your mom or dad or significant other is not here, but how much stress do they have in relationship to you and the situation? And what were their top three stressors? So the client leaves there going, oh my gosh, the whole is greater than the sum of the parts. And so that's an example as if you just say, go do systems theory. People are like, what? And but you use techniques
Mm.
like that, and then it moves into drawing out an apple tree. So you put the symptoms or the stressors on your stress chart that you just completed with the client, and you put them on apples to represent what you see, like an apple tree doctor would look at the
Yeah.
apples and see if they're bruised or stressed out.
Mm.
And then what's fascinating is you say to them, will you be my co-detective? Can we go beneath the soil like an apple doctor and investigate the toxic seeds and undercurrents that are the drivers of these symptoms? And so I say it's just like a doctor doing blood work. They want to look underneath the skin to see, and people get into this narrative because then they get to be self detectives. Like a parent the other day said,
Yes. Yeah.
I didn't realize that we had unhealed wounds is our toxic seed, and the undercurrent or roots was grief issues. We've never even
Mm.
talked about it. And so
Mm.
you move the narrative from the individual to expand the symptom out to let's look at the undercurrent that we have to fix or cure. People love that because they come in very much blaming and shaming each other.
Yeah.
And that tool, the stress chart to the seed tree diagram to the undercurrent, allows people to become part of a new narrative.